Hello, class. My name is Blair Mayu, and this is my presentation on my assigned topic for week 1, Staphylococcus aureus, or otherwise known as S. aureus. So S. aureus is a gram-positive bacteria. It can cause localized infections as well as invasive suppurative infections that can spread to the organs, oral cavity, muscle, bones, joints, and the blood. The bacteria also has the ability to release major toxins that can also trigger an increased inflammatory response of cytokines that can cause anything from necrosis or higher morbidity and mortality rates. Community S. aureus infections are most common, and they're caused by colonization of the bacteria within the body. So most common areas of colonization are in the skin and nares, but they've also been found in the vagina, rectum, throat, axilla, and perineum. Typically, the bacteria's colonization does not cause infection unless there is an overgrowth or there is a break in the protective epithelial barrier layer of the skin. So S. aureus has also become resistant to antibiotics, and they are broken down into the following resistant types: methicillin-resistant S. aureus, MRSA, vancomycin-resistant S. aureus, VRSA, or vancomycin intermediately susceptible S. aureus. And then there's methicillin susceptible S. aureus. So those two at the bottom that were susceptible are not resistant, but they're just kind of put into categories to be able to target the type of antibiotic that you choose when treating these infections. So modes of transmission, healthcare acquired and community acquired. So basically I added this diagram here because I really like how it shows how the S. aureus gets into the skin here, either breaking the skin or it can be from a medical device. Most common are, indwelling catheters, which allow the bacteria to thrive. See, once it gets in there, it can get into the bloodstream. It starts releasing these cytokines. And then once it gets through the liver here, you can see that it can get to the tissues and just really start some invasion of tissues. So there are 3 toxin median related diseases that are associated with S. aureus. These toxins are staphylococcal toxic shock syndrome, TSS, staphylococcal scalded skin syndrome, SSSS, and staphylococcal food poisoning. So basically, TSS is a serious condition. It starts with fever, hypotension, generalized erythroderma, and signs and symptoms of multi-system organ involvement. Most common population are females who have their menses and wear tampons after a surgical procedure or abortion, skin lesions, but it is also common in males and females without any known reasons for TSS. Staphylococcal scalded skin syndrome, it really depends on the age. There's Ritter disease and generalized exfoliation of the skin in the neonate. In the infant, toddler, and older children, there can be painful scarlatinform eruption of bullous and impetigo, or a combination of flaking white skin and brown desquamation of the face and neck. Bacteremia is very rare, but dehydration and secondary infections do occur, so supportive therapy is necessary. Staphylococcal food poisoning is Generally not that serious, but does require supportive therapy. It happens when food is prepared by an individual who has staphylococcal infection, particularly of the suppurative form, where there's actually pus that's contaminated the food. And within this pus is those endotoxin that basically is extremely difficult to kill. So even heating up your food just does not kill it. So prevention here is key. So community acquired S. aureus infections are, like I said, most commonly by colonization of the bacteria within the body. Most commonly that's in the skin and soft tissue and in the nares. And the bacteria's colonization doesn't usually cause any issues unless there's a break or an overgrowth of the protective layer of skin. So localized infections include cellulitis, abscesses of the skin and soft tissue, impetigo, nail infections, mastitis, styes, wound infections, umbilical infections, parotid infections, peritonsillar infections, and lymphitis. Systemic S. aureus infections happens when this disturbance in the epithelial protective barrier, just like in that diagram that I showed, gets deeper into the layers and then gets into this blood and can cause bacteremia, osteomyelitis, meningitis, endocarditis, pneumonia, pleuroempyema, pericarditis, visceral abscesses, and septic thrombophlebitis, which are more serious infections. There's also opportunistic S. aureus infections that occur as a secondary infection from viruses such as influenza causing infections in the lung. Prevention. So strategies to prevent exposure within the community. There's really no 100% prevention of community acquired S. aureus infections because the organism is virtually everywhere, lives in our body and the normal flora, and there's just really not any known biological protection measures for immunity against it. So the strategy for prevention are basically focused on the spread and transmission within a community setting. So basically, that's maintaining personal hygiene by showering daily and after activities that involve skin-to-skin contact. Good wound care by covering your wounds and keeping them clean, minimizing trauma to the skin, so preventing any scratching. Don't share any personal items like razors, towels, makeups, or clothing. Clean all gym equipment or any equipment that's shared and touches the skin. And then for individuals who have recurring infections, there's other precautions that should be made, which should include, following a very strict personal hygiene routine, even some bleach baths, clothing, and bedding that minimize sweating. So treatment. Treatment for S. aureus infections really depends on this resistant or susceptibility strain and the severity of the signs and symptoms of the skin infection that providers really need to pay close attention to that indicate the bacteria is spreading into deeper layers of the skin, either causing an abscess that would need some kind of IND, incision and drainage, or anything that's pointing to systemic symptoms such as a fever, pain. So, and also assessing to any initial treatments that are not, they're not responding to the initial antibiotic treatment. So MRSA treatment of the skin and soft tissue, basically mupirocin to the nares, bathing using chlorhexidine for 5 days, and oral rifampin, doxycycline, and nasal mupirocin for 7 days. Mild to moderate outpatient pharmacological treatment include clindamycin, doxycycline for over 8 years old, minocycline for over 8 years old, and linezol for any more complicated tissue infections and pneumonia, and trimethoprim sulfamethoxazole. So now on to healthcare acquired. So basically, healthcare acquired S. aureus are specific type of infections that happen as a result of coming into contact with a bacteria, either through an infected patient in the hospital or through long-term exposure in a hospital setting or invasive procedures and medical devices. Basically, invasive procedures include central line associated bloodstream infections, catheter associated urinary tract infections, ventilator associated infections, and surgical site infections. So prevention. Prevention of health acquired infections strategies are at the organizational level. It includes competency-based training and auditing to ensure that healthcare professionals are performing safely to prevent the spread of infection. And such training includes education, transmission-based precautions, environmental services, high level of disinfection, sterilization, and aseptic and sterile technique, wound care, healthcare laundry, water exposure, and antibiotic stewardship. So treatment of health-acquired infections really depends on how serious the infection is, if it's life-threatening, if there's bacteremia involved, and then again, susceptibility to the antimicrobial agents. For an unknown susceptibility, MRSA and VISA, the drug of choice with life-threatening cases includes vancomycin and ampicillin, oxacillin, and clindamycin. For MRSA, it's vancomycin and gentamicin, and for VISA, it's linezolid, ceftriaxone, daptomycin, and tigecycline. And here are my references. Thank you, and I hope you enjoyed my presentation on all types of S. aureus.